Hi there, I'm Raya from Active Health Clinic, and today I wanted to talk to you about the hardest part of navigating a fatigue syndrome and also just navigating chronic illness or living in a chronic illness body. Now, the first thing that you'd assume is the most difficult are the symptoms. When in reality, fatigue isn't the most difficult part of chronic fatigue syndrome. It's one of many symptoms that one might experience, the same way that pain isn't the only symptom in a chronic pain syndrome either, or that dizziness isn't the only symptom in orthostatic intolerance or dysautonomia. So one of the first things we need to consider is that it's not just its label. So if it's got fatigue in the title or whatever it has in the title, that's not the only symptom that the individual experiences. And some individuals will experience anywhere from 2 to up to 20 symptoms in the period of a day, week, month, or year. So there are quite a large number of symptoms that fall under these chronic illness categories. And one of the most difficult things is people understanding that it's not just fatigue. And that actually brings me to one of the other points is one of the major struggles of a chronic illness is actually management of others and their assumptions and their misconceptions and their lack of understanding of the actual conditions themselves. So there is a lot of time that we spend navigating people, their understanding, their incorrect assumptions, and how it is that they communicate, how it is that they support or don't support, and what it is that they believe. So sometimes it can actually be the struggle to manage loved ones, family, friends, but also doctors or allied health professionals or medical teams, hospitals, etc. That sometimes one of the most challenging things is actually management of people and their assumptions, and that can be quite a big challenge, and it's quite common. This is why they are called invisible illnesses, because you don't look sick, and therefore you spend a lot of time trying to communicate that you are in fact sick, even though that's not what you look like. And a really big challenge is that we have good days and bad days, and in those good days we're able to do more and present better, and on those bad days they can be really bad, and people generally may not actually see or be exposed to you on those days, and therefore they only see the example of what you look like good, and therefore again that's where those assumptions can come in, or those misconceptions can come in. So one of the biggest challenges in navigating a chronic illness is actually navigating the people and their assumptions behind it, or navigating yourself within dealing with people, unfortunately. So this video is to remind people that if someone doesn't look sick, or you don't actually really know the layers behind it, then you can't assume what they're capable of, or you can't assume how easy or difficult they have it. And it's really important to be supportive and open to asking questions and open to better learning the situation. Now, other things within chronic illness that can be really hard and very difficult, and things that we don't actually necessarily consider, is management of independence, or being able to separate ourselves and who we are, who we were within the illness, out of the illness, and where we are and end, and where the illness starts and begin. Because we may have had a previous capacity that we no longer have, and sometimes we go through experiencing grief of the loss of that, or we may have had a level of independence that we no longer have, and again experiencing generally grief around that, and then having to communicate that on top of things can be quite a challenge. Now, that's also the fact of nobody wants to be sick, and that's a really important consideration. Is nobody wakes up one day and goes, you know what, I want a fatigue syndrome and I'm going to work towards that. It's not actually how things happen, and it tends to be the overachievers, the type A personalities, the incredible empaths, the people that go and do. These are the people that tend to experience such significant challenges within these chronic illnesses, because there's a very big block between what it is you'd like to do and how it is you can do it, or what it is you're able to do. That can be such a major challenge. So on top of this, we need to consider that there's a significant emotional toll on the individual. And then there's a challenge of trying to communicate that emotional toll as a secondary response to the illness, not a primary cause of the illness. Because I know there can be that misconception of it's just in your head, when actually in reality, that's not the case at all. But also having to explain the emotional toll it's having, and separating that from the illness, and understanding what the pathophysiology of the illness is and the drivers of the illness is, and therefore separating the mental health side of things, and understanding that of course that can be a contributing factor, but it's not the cause, and of course that can be a secondary factor because of how challenging the illness is. and symptoms are. So it can be quite a lot, and especially with someone who has a lower capacity than they've had before and they have significant brain fog, this can be quite a challenge to be able to communicate this or any of this, which in itself can be quite a big difficulty within managing this chronic illness. So as you can see, the more I'm talking, the further I'm removing self away from symptoms, and that symptoms are the most challenging part of a chronic illness, and actually leading towards that there are so many other things that are the challenge within chronic illness that we need to understand. And it's like that iceberg visual. You only see the top part, you only see the part above the water, you don't see anything below the water. And it's really important to consider that there's a lot more there that you potentially don't know or that you hadn't considered. And this is something that it's just really important to go, well, living in a chronic illness body isn't necessarily as conducive to life as living in an able body. And that's something that we really need to think of, because there's a lot more hurdles and barriers put in front of someone with a chronic illness that we didn't know were there, that potentially we've put there, or that we could remove, or that we could help them in understanding and help them in recovering once they've gone over a hurdle, because that can be one of the most important things, is supporting someone when it is that they're going on their journey. So there's a lot more, and people may comment below what actually is sort of harder than the symptoms within a chronic illness, because the more we raise awareness to this, then people understand that invisible illnesses, we need to be making them visible. We need to be seeing them. We need to be understanding them so that we can remove some of the judgment, the lack of understanding, and the misconceptions around it, so that these aren't hurdles that people experience within an invisible illness. So I hope that all helps. Comment below if you have any suggestions in regards to what is actually harder than managing the symptoms, or what are solutions that you've found within yourself, within your family or your loved ones, or within your everyday life that you found helping you navigate your chronic illness. See you soon.